Today, we're going to talk about our favorite subject, at least from what the viewers are watching, and that is the Finasteride questions and answers. This one's a little bit unique. I don't like to dwell on the use of Finasteride and the preventatives every video, but this one was interesting to me, and I thought it would be interesting to you. So I was speaking to a patient who came to me from the videos, and thank you again for watching. And his question was, can he stop using the Finasteride? Right away, that's a little bit of a red flag. I asked him to please go on. He had said that he's in his mid-40s. He had been very successful with Finasteride for the last 14 years. He had really good hair. And he feels that his hair was hanging in there or staying really good, really based on the usage of the Finasteride. So as we continue to talk, he had disclosed that lately he just hadn't been feeling up to par. He had talked about things like energy, maybe some brain fog, just things that come along with life, I guess, maybe in your mid-40s or at any age. So I continued to listen. His idea was that if he could get his hairline back the way it was, even at the time he started Finasteride, which was on the weaker side, he would be happy, and then kind of stop using the Finasteride and let the chips fall where they may. So obviously, you know what I'm going to say next. This is absolutely not a good idea. Now, keep in mind, this patient has excellent donor hair. He has what I call a full head of hair. That means there's no signs of any balding or thinning through the mid-scalp or the crown. His donor hair is stellar. He needs a hairline. I think everybody needs a hairline, but that's just me. So why would I turn somebody away and kind of discourage them from having their hairline done if they have everything else intact? Meaning you've done a great job over 14 years of not going bald. And now you're going to reward yourself with a hairline restoration. Well, I guess, as my friends would say, I'm the ultimate optimist, but really, with that being said, I'm a closet pessimist. So what I look for when I talk to patients is what can go wrong. What can become a catastrophe? Probably not going to happen, but you never know. In this case, although we don't really know his genetics based on his family history, although he went into that a little and there was a few red flags, the worst thing that can happen is he continues to lose hair as his hair transplants from his hairline restoration is growing in. That would be, in my world, a disaster. So then we took it down the path where we really need to drill down. And here's the point of this video. Giving up on the Finasteride after success is not a good idea. I'm not a doctor. However, what I read, I'm just like you, a consumer. What I see as far as side effects and all the things we talk about in all the videos are that if something's going to happen to you, if for some reason in the male body you are one of the few, it just doesn't feel right unless you have that DHT, because that's what the medicine does. It takes down the DHT significantly, and the DHT is attacking your hair. For some people, a very small subset, when you take down the DHT, they don't feel right. That would have happened to this patient 14 years ago. He would have known right away. What I'm not a big fan of is kind of scaring people into thinking that the longer you're on this medication, the more apt something is to happen, because that's just not what we see in the industry. I'm talking about the industry as a whole. So with that being said, knowing confidently that after using the medicine for 14 years, there's probably not anything affecting him as far as from the Finasteride. How is his testosterone levels? Has he had that checked? Other blood work? Has he had a tremendous amount of stress lately? I mean, this is a pandemic at this time. That can maybe be a factor. So what I thought was a good idea, and what I think is a good idea for you if you ever go down this path or have these questions, is let's not jump into a hair transplant. Let's not just sign up for a hair transplant, fix our hairline. Of course, that's going to reframe your face. It's going to make you feel better. It's going to make you look better. But that gives you an excuse to get off a medicine that's been holding on to the rest of your hair for the last 14 years. That's not a good idea. We just need to work on the prevention of any further hair loss before we focus on the restoration of the hairline. So I think it's a matter of the clinic or the expert or the educator kind of talking to the patient and explaining that if this is not something that they would do themselves, or they would recommend to a friend or a family member, they better not recommend it to patients. So that information I feel is very helpful.